In this episode, Dr. Roman Pawlak joins us to discuss all things vitamin B12. We talk about the associated deficiency, especially for those following vegan or vegetarian diets. We also talk about signs and symptoms of deficiency and testing for vitamin B12. He sheds light on this topic and provides valuable insights and tips on how individuals following a plant based diet can ensure that they're obtaining adequate amounts of this nutrient in their daily meals. Stay tuned. Dr. Roman Pawlak is a current associate professor of nutrition at East Carolina University and the author of multiple books, including Vitamin B12 Combating the Epidemic of Deficiency. He has published numerous papers in leading American and international nutrition journals, such as the American Journal of Clinical Nutrition, and gives lectures on 5 continents. Welcome, Dr. Pawlak.
Thank you. It's good to be with you and with everyone.
So, Dr. Pawlak, diving right in, I'm so curious about your journey. Please tell us a bit more about your background and how you decided to have this interest in such a niche topic, which is vitamin B12.
I will be glad to do that. I'm sure the listeners will recognize right away that I speak with an accent. I was born and raised, and actually I lived most of my life in Poland. When I was 32 years old, I had the opportunity to emigrate to Canada. And then from Canada, I came to the United States. When I moved to Canada, I actually changed my profession and I decided to study nutrition. So I studied at a few Canadian universities, such as Canadian University College and Athabasca University. And then I came to US and I studied at Andrews University, Oakwood University, University of Southern Mississippi. And already back in Poland, almost 40 years ago, I became a vegetarian. And of course, vitamin B12 is a very important nutrient for vegetarians, vegans, and anyone who is really on a plant-based diet. And so my interest in vitamin B12 developed from this necessity to understand this nutrient because the importance of this nutrient for vegetarians. Also, at one point of time, when I was already teaching nutrition and B12 at the time was not yet my primary interest, I was asked to write an article about vitamin B12. This was for like a popular magazine. I agreed to do so, and I spent several weeks just reading the literature and researching, and I was learning stuff I didn't know. And in fact, I was learning also something that was kind of contrary to what I thought was correct about this particular nutrient. And so writing this article and researching the literature for this article was kind of like a springboard for me to take even a bigger interest in the nutrient. And eventually I started publishing and getting grants and researching this nutrient also in vegetarians and vegans and others.
Lovely. With that, Dr. Pawlak, take us back to the basics. What is vitamin B12 and why is it important to consume it? What role does it play in our health?
Vitamin B12 is one of the B vitamins. We have several B vitamins. I'm sure listeners have heard of vitamin B1, B2, B3, and there are others. Another somewhat maybe well-known nutrient from the B vitamins is folic acid. Folic acid and vitamin B12 are cousins. They oftentimes mimic each other in terms of symptoms of deficiency. They play somewhat similar function. They prevent from similar health conditions, such as, for example, neurotube defects, spina bifida, anencephaly. These are congenital birth defects that offspring develop. And so it is a very important nutrient because it plays a role in the synthesis of an important nutrient, an amino acid called methionine. And then the body uses methionine to synthesize other compounds. And also methionine is converted to other compounds that are important for yet other compounds. And there's a chain reaction. And if there is a breakage in any of the chain reactions, then all kinds of health problems may develop.
Can you speak a little bit to where we can find vitamin B12 for both plant eaters and then non-plant eaters?
Yes, I will be glad to. Interestingly, naturally speaking, vitamin B12 is found in foods that dietitians are telling us we should be consuming less of, or perhaps some of them we should be avoiding altogether. And so meat, for example, is the primary source of vitamin B12 in a typical diet. And of course, again, the dietitians and health professionals are telling us that we should avoid processed meat. We should limit red meat, for example. And so if we actually follow the recommendations, we should have limited intake of perhaps white meat and of fish. And these would be sources also of vitamin B12. Also, animal products such as eggs and dairy products, including milk, contain naturally vitamin B12. When it comes to plant sources, we have actually very few, and only those products that are fortified with this vitamin. That means synthetic form of this vitamin was added to products such as cereal, for example, some cereal, to nutritional yeast, to different soya products, such as, for example, tofu, or some of those soya meat substitutes, as well as soya milk. These would be the sources. Unfortunately, the dose of fortification is relatively low. And so this is why oftentimes in studies, vegetarians and especially vegans are actually found to have very low vitamin B12 and oftentimes below the criteria or cutoff of what we consider a deficiency. And so another source, and likely the most reliable and the easiest way to obtain vitamin B12, especially if you are a vegetarian and even more importantly, a vegan, is to take a supplement. Unfortunately, studies are also showing us that not all vegetarians or vegans use supplements of vitamin B12. In fact, some of them kind of resist the very idea that they may be deficient in any nutrient, regardless of what nutrient we are talking about. Unfortunately, again, when we look at studies, and these studies were conducted in the United States and in Europe and in other places, very commonly vegetarians, and again, especially vegans, are diagnosed with vitamin B12 deficiency.
So let's dive into the deficiency piece of it a little bit more. Can you speak to symptoms that people can look out for to understand if they're deficient first?
Yes, so there are some classic symptoms of vitamin B12 deficiency, but also vitamin B12 deficiency and or what we would call insufficiency, which would mean slightly higher level than what is considered deficient, but perhaps inadequate, higher but inadequate in level, may also cause problems that we may not be aware of and we may not experience until months and or most likely years into the deficiency. Let me begin with those, and I will give you an anecdote. I was invited to go to Charlotte, North Carolina. It was the end of March of 2013, about 10 years ago. And I had two lectures, and these lectures were for everyone, but there were a lot of vegetarians in the audience. And in between, in the intermission, this elderly couple came to me and, just introduced themselves and chatted with me a little. And then they told me that he had a quadruple bypass surgery not long ago. Then they shared that he had never eaten meat in his life. He was a lifelong vegetarian. Now they looked, I didn't ask them how old they were, but they looked maybe about mid-70s. And they asked me, why would I have a need for a bypass surgery? Not eating meat, right? Why would you develop, heart problem? Well, interestingly, I was invited back by the same organization, and I went there at the end of September of the same year. And again, I had a lecture, and in between one lecture and another individual came to me and chatted with me a little, and he told me that 6 months ago he had a stroke. And then he said that he had been a vegetarian for more than 30 years. And then he asked me, why would I develop stroke? And so what we know today, in fact, one of my publications deals with this, is that vitamin B12 deficiency is a risk factor for developing cardiovascular disease, especially stroke, but also some type of heart complications. Of course, we know that vegetarians and vegans have improved cardiovascular disease risk factors, include improved profile. And so they often think that they would never develop heart disease, and that's what we would expect. Unfortunately, again, this is one of the symptoms. We also know that vitamin B12 deficiency is a risk factor for bone fractures, low bone density and bone fractures. Again, these are symptoms that we don't know of until we have a heart attack, right? Or we break a bone. Now, when it comes to kind of classic deficiency symptoms, these are grouped into several categories. So, for example, hematological symptoms that has to do with the blood. So we may have elevated or larger than normal red blood cells, for example. And in fact, vitamin B12 is essential for all blood cells synthesis. So not just red blood cells may be impacted, but also white blood cells count, platelet count, and also a compound called homocysteine. I know this may be a new term for many listeners, but I'm going to repeat this term because this is an important term, because a lot of complications that result from vitamin B12 deficiency have to do with this particular compound. Again, it is called homocysteine. Elevated homocysteine is a risk factor for many health conditions, including those I already mentioned, heart disease, bone fractures, but may also be detrimental for pregnant women and their offspring, may cause different problems for the fetus. In addition to hematological symptoms, we have neurological symptoms, and these include stuff like feeling pins and needles, okay, feeling what is called restless leg syndrome. That means you go to sleep and you may all of a sudden have uncontrolled leg movement. Also, you may have hard time falling asleep, or you may wake up in the middle of the night and then you have hard time falling asleep again. These are all related to vitamin B12 deficiency. And then there are others. There are symptoms in the oral cavity, for example. A classic symptom is called beefy tongue. Beefy because it looks like a red beef type of color, very red, and there is a specific type of shape of the red spots in the tongue. You may also develop different cracks here at the corner of the mouth. You may have inflamed and or reddish color around the eyes. These are, again, dermatological and oral cavity type of symptoms. There are others, developmental, when we are talking about infants, toddlers, young children. We know that when you are 4 months or so, maybe 5 months old, you should be sitting on your own, right? When you are about 1 year, maybe a little past 1 year, you should be able to walk and maybe even run. And toddlers who have vitamin B12 deficiency may not be able to even sit on their own. They may have anorexia. They may fall off their growth charts. They may completely lose a touch with their surroundings. I had a correspondence once with a mom who told me that the child completely did not only that didn't react to any stimuli, didn't react to her voice, nothing of that nature. Fortunately, very quickly, we were able to restore her vitality and stuff like that with specific therapy that I recommended. But there are many different symptoms, and they are manifested in different ways for different individuals. I know that you focus a lot on diabetes also. Let me just mention that individuals with diabetes who develop a vitamin B12 deficiency oftentimes have neuropathy. And that neuropathy is oftentimes also misdiagnosed because individuals with type 2 diabetes are at risk of diabetic neuropathy. And so if you have type 2 diabetes and you develop neuropathy, it's kind of normal because patients with diabetes develop neuropathy. But in reality, many of these patients do not have diabetic neuropathy. They have vitamin B12 deficiency related neuropathy. And that neuropathy, again, may be manifested with different neurological symptoms that include those I mentioned, such as pins and needles, and feeling pain, kind of deep pain in the nerve somewhere, these type of symptoms.
Yeah, it is so hard to even distinguish that of what may be causing that neuropathy. Is it the diabetes? Is it the vitamin B12 deficiency? Is there a test around it that can confirm a deficiency?
Yes, so that we would do hematological tests. We can measure serum vitamin B12 level. We can also measure homocysteine, that compound that I mentioned, and homocysteine is a somewhat reliable a marker. Serum vitamin B12 is less reliable, actually, marker of vitamin B12 status. Homocysteine is a reliable marker, especially among those who consume adequate amount of this other B vitamin called folic acid. And so if you are a vegetarian and a vegan and you likely consume a variety of plant products, including fruits, veggies, beans, if you have increased homocysteine concentration, it would be more than likely a result of low vitamin B12 rather than low folic acid. There are other tests, for example, methylmalonic acid. Okay, these tests are seldom utilized in clinical practice unless a patient is referred to hematologist or neurologist. And there are still other tests that are even less often used. Unfortunately, when you go to your primary care physician, oftentimes they just order the white blood cell panel, which includes a test called test for the size of red blood cells. Okay, and they look at the size of red blood cells, and if it is not elevated, vitamin B12 deficiency is oftentimes ruled out. Unfortunately, this is a mistake because we know that at least in about 1/3 of the population, regardless of how low vitamin B12 may get, we will never see it on this test that measure the size of red blood cells. So what is recommended for anyone who would like to test for vitamin B12 is that at least 2 different tests are performed. So that may be homocysteine and vitamin B12, for example. Okay, that way we can see if one is normal, the other is not, then we may either conduct yet another test, or at least just precautiously simply use either vitamin B12 supplement or injection to treat vitamin B12 deficiency. This is because the tests that are available and are used in clinical practice are not very reliable, and those tests that are reliable are more expensive, not as easily obtained. Not all labs conduct these tests, and that's why two different markers or two different tests are recommended to take.
You know, we talked about deficiency. I kind of want to flip it to the other side and talk about what would be the downsides of consuming too much vitamin B12. Is it even possible to consume too much?
It is possible, but we very seldom see symptoms of excess of vitamin B12 intake. And the symptoms of having too much vitamin B12 are not many, and mainly they have to do with dermatological issues. So you may kind of scratch yourself, you may see a little redness, kind of like you would have an inflammation type of thing. And these are really, or this is really the most common one, which is, again, not very common. So when you look at, again, serum vitamin B12, you know, anything above 300, whatever the units are, on the test would be considered a good level of vitamin B12. So only individuals who have at least 1,000 or maybe even more than 1,200 units, and only very small percentage of those develop these symptoms. So vitamin B12 deficiency is much bigger problem than any risk for excess. Let me mention another interesting nuance here, and that is some individuals may actually be deficient in vitamin B12, and in the same time, they may have very high serum vitamin B12 level. This is because they may have another underlying condition. For example, if they have some type of liver problem, liver abnormality, and or kidney problem, or even lung problem, or they may have cancer. These conditions cause the body to secrete a large amount of a specific carriers in the blood of vitamin B12. And so you will see elevated vitamin B12 and yet symptoms of vitamin B12 deficiency, you know, but it doesn't mean these elevated tests does not mean that you actually have excess of vitamin B12. And the symptoms oftentimes when they are treated with either supplements or injection would disappear.
My next question for you on this, Dr. Pawlak, is, you know, you mentioned vegetarians earlier. What are steps that vegetarians and vegans can take to ensure that they're getting enough vitamin B12 in their diets? And what role should healthcare professionals play, such as dietitians, in really educating patients about vitamin B12 and plant-based diets?
Well, good questions. I believe that all vegetarians, and especially vegans, should be using vitamin B12 supplements. And this should be done really from early on. So even when we are talking feeding toddlers and feeding young children, we should be ensuring that they use supplements, because this is simply the easiest, the least expensive, and the most reliable way to ensure that we have adequate vitamin B12. Just to give an example, I buy my vitamin B12 supplements from Walmart pharmacy. And in the container, you have 200 pills, and the cost is just a little bit over $4. Okay, so $4 that you spend is good enough for a year, or maybe a little bit more than a year. I don't take them every day, I take them every other day. And it is just that easy to do so. And I also believe that not using supplements, even if you ingest foods that are fortified with B12, means placing yourself at risk of inadequate intake. And of course, that translates to inadequate level in the blood. And, you know, if you are lactating, say, it translates into inadequate concentration in breast milk, and so on and so on. And eventually you may develop symptoms. And even if you don't feel symptoms, like I mentioned earlier, there are these symptoms that develop over time that we have no idea of, that eventually you may experience. When it comes to what health professionals such as dietitians, physicians should play, well, again, number one, they should be up to date on the literature on vitamin B12 and the main recommendations. I have to say, unfortunately and sadly, this is not always the case. In fact, if you go to, even still today, to the National Library of Medicine website, and you read the information on vitamin B12, it's a short statement, and the statement contains three-part misconception about vitamin B12. It includes, in the statement, you will read the information that vitamin B12 deficiency is very rare, okay? It's nothing bad. It's actually very common. It is an epidemic, or even called pandemic. And regardless almost where you go, you find large proportions of populations at risk and have documented vitamin B12 deficiency. But again, in consumers and patients learn from health professionals. And so if health professionals spread misinformation, that's not giving good information to the patients. Another thing is, when it comes to especially physicians should be also following recommendations. So for example, since 2017, the American Diabetes Association has issued a recommendation that anyone who is on metformin, and metformin is a drug that is prescribed for people with type 2 diabetes, gestational diabetes, even those with prediabetes, okay? Those patients should be tested for vitamin B12 level and then prescribed either injection of B12 or supplements according to the level. Unfortunately, this is completely not followed, okay? So patients may be tested for B12 if they complain about neurological symptoms, rather than prophylactically testing them for B12 and then catching the low level earlier before any symptoms develop. So yes, learning about the current information about the nutrient, following the recommendations, and especially when it comes to vegetarians and vegans, definitely recommending that they use it, because they come to those professionals for reliable advice, right?
I'm going to try to squeeze in one more question before we wrap up, Dr. Pawlak. You mentioned the supplements in particular, and we get this question all the time. But is there a difference in dietary value of B12 from supplements versus food sources?
Well, thank you. Well, first we have to remember that, again, when we are talking about anyone who is on a plant-based diet, whether that's a vegetarian diet or even semi-vegetarian, and especially vegans, you really have very few options, because vitamin B12 is synthesized by bacteria. And so the reason why we find B12 in an egg or in a milk or in meat is because the B12 that is synthesized by bacteria is then eventually spreading to the muscles or milk and so on. Again, vegetarians and vegans don't have this luxury. They have to rely on foods that are fortified. Like I mentioned earlier, these foods are few and the dose is very low. And therefore, there was actually even a study, it was a study done in Poland, the country of my origin, in which young people, and young people don't have any problem with absorption of nutrients, including vitamin B12. And as we age, we actually lose also the ability to absorb vitamin B12. But these young people who were in their 20s were asked to ingest foods that contain vitamin B12 by fortification, okay? And this experiment took place for 5 years. And over the entire 5-year period, you had a steady decline of serum vitamin B12 level, okay? Which showed that, again, it is simply inadequate to rely on these foods. And so, we can theorize that obtaining nutrients from foods is better. And I actually prescribe to this idea. When it comes to many other nutrients, say vitamin C, for example, some people use vitamin C supplements. I don't think there is a need for that because we can obtain enough of vitamin C from diet. We can name a number of different nutrients, and the same will be true for these nutrients. But for this particular nutrient, it is really an exception because we simply do not have vitamin B12 in plant foods.
This is very informative, Dr. Pawlak, but unfortunately, we are toward the end of the episode. At this point, can you tell us how our listeners can connect with you and then just learn more about your work?
Absolutely. So they can go to my website, which is romanpawlak.com. Okay. www.romanpawlak.com. Okay. They can also find me on Facebook, but it is my personal page, so I don't often post anything on whether vitamin B12 or vegetarian diets or things of that nature. They can email me directly if they have a question, pawlakr@ecu.edu. And I have different articles on my website. I have links to my publications on my website. I have some lectures also linked to my website. If they also type my name in YouTube, I have different lectures on YouTube in English and in Polish. I still speak Polish somewhat fluently. If they would be interested in learning more about whether vitamin B12 or related topics, they can also find me on Dietitian Central website. Dietitian Central, I believe it's .org. I have more than a dozen of different webinars on, again, topics related to plant-based nutrition and vitamin B12 specifically. And lastly, they can also go to orionpublishing.org and they can get my books, including the one you mentioned, Vitamin B12, Combating the Epidemic of Deficiency. But also I have a book for vegetarian adults called In Defense of Vegetarianism, and then another one for pregnant and lactating women and how to feed young children called Vegan, Vegetarian Mother and Her Baby.
Lovely. And what we'll do for our listeners, we will link up all of these different resources for you in the show notes so you can find them there below this podcast episode, so you can link to it and find these various websites. And with that, Dr. Pawlak, thank you so very much for your time. For our listeners, share with us whether you have experienced any difference in how you feel or function after taking vitamin B12 supplements. So head over to our social media on Facebook, on Instagram, find this podcast post and comment below to let us know if you have experienced any difference in how you feel and function after taking vitamin B12 supplements. And with that, Dr. Pawlak, thank you so very much again.
Thank you very much. It was my pleasure.